help us. Okay. Hi, everybody.
Hello.
Hi.
I have to consent to being
Oh
recorded.
my gosh. Okay, first off, this
I
is a
consented.
year. Oh, you have to consent. She's consented. We are good to go. You know what? This has been
Hello.
this. We have been on here. This has been our meeting. We are now a year as a support group. And I was talking with Sue earlier, and I didn't realize until we were talking that Sue was the very first person we had who presented a session for us, and it was on relaxation, which was phenomenal. But I'd like to welcome, yeah, it was great. So I'd like to welcome everybody here. My name is Lanice. I am your host, and I pretty much know everybody on here, but I'm going to start real quick. Just if you give your name, just your name, just your state, and what type of PH you have. Meanwhile, I'm admitting people as we go, so just ignore me. So I'll start with me. My name is Lanice Whitley. I live in Brooklyn, and I have PH secondary to, associated with left heart failure. And I'm going to go by my screen. Doreen, how about you next?
Yes, my diagnosis is just like yours. I'm from New York. And what else am I supposed to tell you? That's it.
That's it. Okay.
COPD also.
Okay, Denise.
Hi, my name is Denise Robinson. I'm from Brooklyn.
Go ahead, Denise.
I have pulmonary hypertension with COPD and left heart failure.
Wow. Look at
Yeah.
that.
Okay, Marcel, unmute yourself.
Hi.
Hey.
Hi.
You hear me?
Yes.
Yes.
Yes, my name is Marcel Giddens. I have suffered from hypertension. I was diagnosed in 2013.
Okay, and also we have Miss Vanessa. Miss Vanessa, how are you?
All right. Yes, my name is Vanessa in Colorado. PAH diagnosed in 2018 and treated aggressively. So I am now no longer in triple digits pressure number.
Excellent.
And
Thank you so
live
much.
indoors off of the leash as long as I don't walk around too much.
Thank you. Okay. Well, thank you very much for joining us. I know some other people have, but I don't see you on my screen. But I will get back with you later. But right now, I'm just going to get a few housekeeping things off our plate, and those that I don't see right now, I will go ahead and call on you when we get done a little bit. And so basically the housekeeping things are, I want to tell you about our unmet needs. It is now, the Unmet Needs Fund is now called the Megan Michelle Hicks Fund for Unmet Needs. It was named after Megan Michelle Hicks, who was the daughter of one of our board members, Carl Hicks. His daughter passed away after she received the double lung heart transplant at the age of, I think she was like 27, 28. So we renamed our fund after her. This is a fund where it's available to anybody with PH or PAH. If you have a child, then, of course, you're the parent, so you get it for that. And then what we're doing, I'm going to have to mute everybody because there is a little bit of okay, everybody please mute yourself. Thanks. So basically what this is that it is a fund that is available to everybody who has PH or PAH, and it's a $500 once a year thing, and you can get it. It's no credit check and all that other good stuff, and it's made to be used for needs. If you have a need, not medication, but a need, you can't use it to go on a vacation or anything like that, but if you have a need, and it's open usually on the first of the month. So that one is that. And then we have our Let Me Be Your Lungs Fund. If you know somebody who is an athlete or who is somebody who, you know, just, sorry, hold on. Okay, okay. Well, we have somebody who runs triathlons or whatever, and they will run in support of symbolically being your lungs, and they can raise money, and the money goes directly into the Unmet Needs Fund. Now, for a little while, we have just opened up a fund for people in Puerto Rico, patients in Puerto Rico, PH or PAH, and these patients can apply to get the grant because if they are in that hurricane area. Okay, so you can go to our website, teamphenomenalhope.org, and see all that. And that's it for the announcements right now. I'm going to ask everybody, please mute your device. And thank you. If you have a phone, *6 it. If you're on a laptop or whatever, just please mute it. And I'm going to introduce Miss Sue Gammill. Sue, I mess up. Sue Gammill. Sue was our first presenter, like I said before, and she was said I didn't realize that she was our first presenter. So I'm so glad it's like an anniversary thing because this is the first year of our support group.
Yay.
Okay. So and I'm so glad to see those because some of you on this line have been with us from the beginning. Thank you so much for your support. Sue has done so much. I'm not even going to try to like read her bio or anything because Sue can tell you that because oh my gosh, it made me tired the first time I looked at it. So I turn it now over to Sue, and Sue will tell us how you want to do it. We could hold questions till later, if that's okay with you.
Yeah, let's hold questions till later unless you're just bursting to ask a question and then go ahead and ask because I can be flexible. Okay.
Okay, works for us. So
can you see my screen?
without further ado, Miss Sue Gammill. Yes, except for this one line that is like a blue. It's like we see Team Phenomenal Hope support group, but there's like is there supposed to be like a blue?
It's a dark line and it's got my name in it, but you've got my name.
Yes.
So Lenise, thank you very much for inviting me back to talk with your group again. It is an honor. So I think the topic Lenise asked me to talk to today is one that we all struggle with. And for different reasons, I've had my learning experience with that this year. And so we're going to talk a little about, well, we're going to talk about what PH is just a little bit, and then we're going to talk about family and friends who don't understand. And I actually have found some resources, and there's a little bit of a challenge in here for you. It's, I think, an opportunity. So without further ado, I was invited to speak at the PAH conference in Atlanta, which I did. I was asked to speak about mental health and the mental health challenges, which are all part of having a rare and a chronic disease. And so I've edited that presentation a little bit. I've added some things, taken away some things. So here we go. So each of us here has a relationship with PAH. We may be the patient, we may be the caregiver, we may be the spouse or partner, the mother, the daughter, the father, the son, the nurse, the doctor, the counselor, the friend, the confidant. So I'm certainly the nurse. I'm also a friend to a patient with PAH. I think I'm probably a counselor for a lot of my patients with PAH because of all of my years of nursing. So to give you a little bit of my background, I've been a nurse for 46 years. And for the last 6 years, I've worked for CVS Specialty Pharmacy with PAH patients as a nurse educator. And so I've traveled out to many people's homes and hospitals to teach people about the disease and teach people about the medicines and what the goals of the disease are. So that's just a little bit about me. So we know that PH is a chronic disease. We know that it's currently incurable, but quote, manageable. We know that it is not just a physiological disease. It affects your mental well-being, your emotional, and your psychological entity. And that's what makes up the whole you. And we also know that it's a family disease. It doesn't just affect you, it affects everybody in your family. We know that it's rare, and we know that it is hard to explain to others. And that's what the bulk of this conversation today is about. And I will just tell you that I don't have a magic pill. I don't have a magic answer, because I think it's hard to explain to someone else a disease that is rare. And it is certainly a life changer. And doctors sometimes talk to patients about the new normal and that they need to get used to their new normal. And this year, I actually understand that. Back in February, my husband was diagnosed with stage 3B colon cancer. And so we have gone through, and Charlotte, I feel your sadness. My husband is still living, but we have gone through a major surgery, 6 months of chemotherapy. We've just finished the chemo, and the doctor is very clear to say, you know, you cannot relax for 3 to 5 years. This can come back. He's not overly optimistic. So I do understand it in a different way, how it's hard to explain to others what you need. But for PAH in particular, it is even harder to describe because there are not many ways. Well, there are not many people that experience it, so they don't really know. So we also know that PAH, because of all those things, is scary and overwhelming. It is challenging for family members to care for somebody with an incurable but manageable disease. It invokes a lot of fear. It's difficult to predict its course. We don't know whether people are going to progress rapidly or slowly. And unfortunately, and I'll tell you what, I'm very optimistic because I think there's a ton of research going on that is identifying more and more information about PAH. There are new drugs being researched. The researchers are looking more at the role of the inflammatory response in PAH. And I think they are really identifying that inflammation has a much larger part in PAH than perhaps it was thought, not just in PAH. We knew the inflammatory system, immune response. We knew that that was part of PAH for connective tissue diseases, but I don't think we necessarily thought it was part of PAH for all the other causes of the disease. But now it appears that it's a much bigger player than they thought. So I am hopeful. I mean, I was a nurse back when there was no cure for PAH. And the first drug that came out on the market was Flolan. And I was working in a children's hospital in the intensive care unit in 1998 when we hung the first Flolan on one of our PAH patients. And I remember that day very clearly. And prior to that, there was really nothing. And so the encouraging thing is that the landscape has changed quite a bit. And I'm constantly amazed at the number of people that are working on solutions and research and improving the medications for the patients. But it does change your life. And even with all of this research, they know about doing risk scores, but there's no test to do to say, this is what's going to happen with your PAH. It just isn't. And so it affects everything about your life, your physical life and your emotional life as well. Mental health, psychological health is all part of that well-being. And that is part of the struggle with families and getting them to understand, because I think they can't see your disease, and so they can't understand it in a way that you can help them. So your overall health, your emotional health, your physiological health, your social well-being is all important. It affects everything that we do, and it affects how we cope, feel, and interact with life. So they did a study in the US, and I'm going to try and shrink down my camera screen so I can see. There we go. So they did an impact on quality of life in the US, and this is for PAH and how patients prioritize the effect of the disease on their quality of life. So overall quality of life, 60% of people in the survey said it had a major impact. 38% said some. Less people said it had an effect on their mental and emotional well-being. More people said it had some effect. Life expectancy concerns. Half of all patients have major concerns about their life expectancy. And that's particularly true for our younger patients or for patients that still have young family and even young adult children. But everybody, 90% of patients in this survey reported being impacted by quality of life concerns. And then interestingly, only 26% said it had a major impact on their relationship with their family. 53% said some impact. And that probably is partly a factor of how close you are to your family, what kind of relationship you have with them, geographically, how close you live to them, that type of thing. Here's another interesting fact. We know that PAH drugs, every therapy for PAH, we know does two things. We know that it slows the progression of the disease, and we know that the goal of the drug is to improve your ability to do daily tasks or to live. And everyone says, oh, you'll get on this drug, it'll be great, it will really help you. Well, the drugs do help you differently for different patients. And so I think that's one thing that can affect how you feel, because you hear other people say, oh, this drug was wonderful for me, but it may not be wonderful, for somebody else. But the adverse events make people actually have more depression. So if you are taking the drug and suffering adverse events with the drug, then you report, though those patients reported 64% depression. And I think that makes sense to me as a nurse. And that's because you've already got a disease that affects how you feel every day. Now you've added a side effect to it, and it definitely impacts how you feel every day. And so my one thing as a nurse would be to say, this is not so much well, it may be in helping your family understand that it's bad enough to have the disease, but to have the adverse events on top is an additional burden. And I think people sometimes don't understand that, oh, you should be glad you're on the therapy. You should be feeling better. You're on the therapy. And I think as patients, it's really important that you go back to your provider or your PAH nurse and you say, I'm suffering side effects and they are making me miserable. In fact, I talked to a lady yesterday who lives in Maryland and her nurse is on vacation. So as the supervisor, I'm covering for her. And she started taking up Travi, and first dose went okay, second dose was worse. And she said it had made her just not go out anymore and not feel like doing anything every day. And I said, that's not what we want. That's not the goal of the therapy. And it may be that that therapy is the wrong one for her, or it may be that she needs a much lower dose. But I think what my big point is don't just suffer the adverse events, because they have an impact on your overall feeling, not just your PAH, okay? So challenges for families with PAH is depression, anxiety, and panic disorder, especially when your oxygen is low. And so we all know that we need oxygen to be awake, alert, not afraid, to be able to do fight or flight or any other of those things that we need to do. And struggling for breath and having a low oxygen level is hurtful. It's harmful to your body over time. And it also increases your anxiety and your panic because it makes you feel like you can't breathe. So if you are having panic disorder, it is nothing to be ashamed of. It is a very real thing with PAH. And you need to find strategies to help take care of that panic so that you can relax and you can recover your breathing and you can recover from your episodes of if you've exerted yourself too much or done too much. And I will say that I was very pleased at the PAH conference in the scientific sessions that I attended, that I really heard a lot of the kind of go-getters in the world of PAH talk about, if you will, the importance of the PAH physicians and science community understanding the needs of the patient more. You know, as physicians and scientists, they want to go out, they want to find a cure, they want to do all of those things to help you. But if they don't stop and think about how it makes all of you feel, then they're not really being your best advocate. And so I was very pleased to hear them say, even the proposal is, for instance, that research studies now get designed with patient input about what the patient is looking for out of a study. Because the doctor can say, hey, Sue, go in this study, it will really help you, but they don't ever ask me what I want out of the study. And maybe I want something completely different. Maybe you want something completely different. And so being engaged and speaking up is, I think, something that we're going to see improve in the world of PAH. And I would encourage all of you to keep advocating for that. Obviously, pre-existing societal, cultural, and psychological issues are a factor. I had a lady that is from Cuba, and she came over to the US many years ago, and she has PAH, but she just has a very difficult time trusting the healthcare community because of her experiences in Cuba. And it's extremely difficult to get around some of those things. Have people that don't believe in medicine, or family members that don't believe you should need antidepressants or pain medicine to help you with some of these PAH things. Religious preferences or positions on medicine and getting support. And sometimes that can feel very unsupportive as well. And all of these things, obviously, because of PAH, occur in greater incidence than just in the rest of the population. So inevitable changes you face, and you already know this unless there's a brand new patient on the line, is you do have to adapt. You do have to adapt to new roles. You have the physical disease of the symptom and the symptoms of the disease and its progression, which you have to be attentive to and listen to. You have to deal with worsening ability to participate in normal activities, perhaps, significant employment and economic burdens and costs of care. And this year has been a very bad year for that. Therapy adverse events that we've already talked about. And just so you know, for PAH, any adverse effect is a side effect, whether it's listed in the literature or not, that you experience while you're on the drug. And I will tell you, as a PH nurse dealing with patients, that one of my ILD patients, interstitial lung disease patients, reports that her depression is worse. Well, that's not a listed side effect of Tyvaso. But when I went digging in the research, actually 1 to 10% of people experience an increase in depression with Tyvaso. So we report anything like that, we are required to report to our pharmacy. And so I think if you're feeling something new, it's important to share that with your care providers, because you may be struggling with something that there's some help for. And then obviously this changes in intimacy, and then for our younger female patient population, the risks of pregnancy and how that changes a person's life plans if they were younger. There are also opportunities. So the big things are advocate for yourself, find something that pleases you and do it. Doesn't have to be a great big thing. There's the straw test, which I'm going to show you at the end. There's an opportunity for you to be a sponge and tap into all of these resources and support groups. It's important for you to define and use a circle of support. And what I will say is that one person isn't going to be all of your support. You're going to need probably more than one person. And there's opportunities because you are unique, but you also know that if you join a support group, you're not alone. And there's a great deal of power and help in being connected with other people in the community. And actually, the numbers of people living with a rare disease, it was kind of staggering to me, because it's something like I didn't print that one out, something like 30 million patient nationwide. I mean, worldwide are living with what they consider a rare disease. So that seems like a lot of people suffering with rare diseases. I don't know if any of you do any research investigation on the NORD website, which is the National Organization for Rare Diseases. They are very much an organization that works to help with advocacy and understanding for people with rare diseases. So I do think it's worth looking into what they can offer and their ideas. I think it's important to speak up and say what you need. Try to communicate things a different way. I think you have to recognize that all support is not. That social media is a double-edged sword, because if you're on some social media support groups, some of them can be very helpful, but then there is also the impact of the negative people. And sometimes you just don't want to deal with the negative stuff, because not everybody is having a negative experience. But we all know that human nature is, when do we complain the most? We complain the most when we're unhappy, right? So if we go out for a great dinner and our dinner is wonderful, we're going to eat it and enjoy it, and that's going to be lovely. If our dinner is awful, we're going to complain. And so that is human nature, but how much you expose yourself to that is something that only you can decide. This was a study that was done on people in Europe, 600 participants, was it 600? 463, I think, participants. And they looked at the effect of PAH on work and employment for patients and carers. They weren't asked about how much money they made, but you can see that the patients are in blue and the carers are in orange. And so huge impact on employment ability and the effect on employment for somebody with PAH. 48% inability to work. So that's half of the population. But for any of you that have continued to work or had to give up work, you know that continuing to work comes at a cost, because you're tired and you're fatigued. And I've had several conversations with patients recently, and I'll just be honest and share that one of our patients was running out of medicine. And when I went back and I looked through all the history, what I realized is that sometimes she knows it's time for a refill, but because she's working and she's tired when she gets home, she doesn't call the pharmacy back. And then they call her in the day when she's working, and she can't talk to them. And suddenly there are trickle downs and you're suddenly in a crisis where you're short of medicine. And it's just a situation that I think we as the PAH specialty pharmacies can do a better job of understanding what your needs are. So, you know, if you're working or if you feel horrible in the morning, we don't try and come and see you then or telephone you then, that we try and get it at a time of day that's better for you. And then obviously there was a significant impact in Europe on reduction in household income. And I will say that overall cost of living in Europe is much higher than it is here. Interesting, this is a little bit hard to read. So this is emotions, okay? So 28% of 303 people said they sometimes or often felt frustrated. 23 said they never felt frustrated. And the lowest numbers of feeling frustrated were rarely and very often. The highest number in feeling misunderstood, and this is why I think we're talking about this today, was 30 out of 303. And that may not seem like a lot, but it's over 10%. And I thought in England, it was interesting that 28 of the respondents said they never felt misunderstood. So I don't know what they're doing that we're not doing. High numbers of people that report feeling little pleasure in activities they previously enjoyed. Often impacted by feeling angry. Highest numbers of feeling low self-esteem and low confidence on a sometimes basis, not an often. Would say the numbers for often and very often there are under 20 of the respondents. Biggest thing, which is what I know all of you understand, is afraid of what the future holds. And 66% of 126 patients all reported often and very often feeling afraid of the future. 50 of the respondents talked about often and very often feeling stress about their caring role and other responsibilities. That's for the carers. I thought this was interesting. 50% of the respondents of 59 of 124 people, so approximately half, felt that they should be doing more to help their relatives sometimes or often. A large number of people feel that they have no choice to look after their relative, which is difficult. It's difficult for them because they feel that they have no choice. It's also difficult for you as a patient because you feel the pressure of that. And you feel sometimes it's guilt that somebody's having to do that for you. Sometimes it's that you're a burden. There are all sorts of emotions that go with that. And I'll tell you, because I turned off my camera screen, I can't see any of your faces, so I don't know what you're doing. So you could all be sticking your tongue out at me and saying you disagree with me. And then the carers, which were 122 of them, over half of them sometimes and often felt that they could be doing a better job. And so this made me think about how do the carers feel and what is their struggle? And I'm not saying you should take on their struggle, but I think it might be insightful if we could talk about what is it like to be the carer or the significant other of a person with PAH. This is what I thought was very interesting in the European group. 67% of them wanted information on the disease and the therapy, and that's in part because some of the therapies are not as advanced over there. They wanted information about the disease. I think information about the administrative consequences is things like work and, ability to earn income, getting on Social Security in England, the equivalent of Social Security. 52% wanted information about travel. I think that's probably a bigger thing in Europe because it's so small And a lot of European people travel a lot. That's just the way they live. And I thought it was interesting that a fairly low number of people were actually concerned about anxiety, depression, and other emotional consequences. And I don't necessarily think that's a healthy thing. So we all know that words are not everything. That 55% of our communication is body language. And any of you that are married or have had a partner know very well, or if you have children, you know very well when they're ticked off about something, because you can see it written all over their body. My husband knows if I'm PO'd, pardon my French, without me saying a word, just because of how I look. One of my daughters, her face is like rubber, and I always know how she's feeling because of her facial expression. And so if you're thinking about how your family and your carers interact with you, that's true for you too. You know, if you ask them to do something for you and they roll their eyes at you, that makes you feel bad, right? Because you feel like you're asking them to do something unfair. So then we know that tone of voice and how you, wrong thing. Tone of voice is another big section of it. I tried to expand my screen, but it just won't work. 38% is how we sound. Do we sound angry? Do we sound annoyed? Do we sound sad? So it's a huge part of it. And the actual words that we say only account for 7% of communication. And yet, isn't it interesting that we place so much attention on the words that people say? And we don't necessarily think about it as a whole of communication, and we get hurt by words. Think about that little, I don't know, as a proverb, as saying a ditty when I was a kid growing up in England, you know, sticks and stones will break my bones, but words will never hurt me. And I think how untrue that is. I think, yes, your bones can break and they can heal, but words can really actually hurt you forever. And yet they're not the only big part of communication. And I just think it's something to be mindful of as we communicate, because communication is a two-way street. So that's the challenge. So this is what I started to think about is, as a patient with PAH, can you help your family understand PAH? And there's one little exercise you can have them do. Well, there's a couple of little exercises you can have them do to try and mimic what it is that you feel every day. But I think it might be important for us, for you as patients, to help your family understand, because what I realized from my reading is that, and what I'm going to do after this meeting is I'm going to send Lanice some of the articles I found and the information, and so she can share it with any of you that want it. Most people want to help, but most people don't know how. And in their effort of trying to help and not knowing how to help, they usually do something wrong and they make things worse. And it frequently is not intentional. I'm not going to say there's some people out there that aren't intentional about it, but I think it's frequently misguided. So I think one of the things for yourself is to remind your family that you are not just this disease. I am not just PAH, I am still a whole person. I'm Lanice, I'm mother, woman, friend, PAH advocate, all of the other things, a romantic, an emotional person, a stress eater or a stress starver, and all the other things that make up Lanice. And I think it's important to not let the disease state of PAH become the entire focus of what you are. Does that make sense? I think it's important to understand that every
Yes, it does.
emotion. Does someone have a question? I think everyone's thoughts, emotions, feelings are affected. And what I believe is that we often misunderstand what people are thinking and feeling. And as a society, we're not really very good about expressing that to one another. You know, I feel sad today. I feel overwhelmed today. I feel emotional today. I feel fatigued today. It's very hard. Or I feel happy today. I want to go out and get an ice cream today. But if Mr. Misery Guts over there doesn't want to go out and get an ice cream with you, you're probably not going to go get your ice cream. And so that's one of those things. That's part of reminding them that you're a whole person. Yes, I have this disease, but I'm also still a human. And so I think part of the need to understand is that caregivers have feelings also. They don't know how to articulate them. And perhaps they are afraid that they will be perceived as selfish if they tell you how they're feeling. So I'm going to give you one suggestion here. And that is that if you can engage family or friends in a conversation about support and understanding, that instead of using words, it's safer to use numbers. So you can say to them on a, like the pain scale, we all know the pain scale, right? 1 is no pain, 10 is the worst pain ever. You can turn that into anything you want. Physically, how do you feel today? Do you feel a 1, a 4, a 6, a 9, or a 10? How do you feel emotionally today? 1, 4, 6, 9, 2. And somehow it's safer to use numbers. And so part of the exercise I'm going to challenge you to try and do, and we can talk more about this and how to best do it, is to begin with a scale of important issues. So help around the house, fear that you're not taking care of me, fear that you're going to abandon me, fear that you're going to die, annoyance with you because you won't help me, or I don't feel good today. And you can pick any number of those subjects. And rather than delving into the big words of what that is and the emotions and all the things that that trigger, try using a number scale, because it will tell you very quickly whether someone's on the low end of the scale or the high end of the scale. And that can be a good, safe, a number is safe. That's a good way to start the dialogue. So that if you practice doing that, then you can say, well, what's making you feel like a 4 today? Or can you tell me what's making you feel like a 4 today? Because it may not be everything. It may not be your whole pH that's making you feel like a 4 today. It may be that you had a horrible night's sleep, and if you could take a nap and they could keep your house quiet for you or go to the grocery store for you, you could feel better in the later part of the day. And then you say, now I feel like a 7. But I think it's an interesting way to try and communicate. And that's actually something I learned this summer with my husband. And I learned that from other cancer patients and carers who couldn't find the words, but could say the number, which was very useful. And what I will tell you is that it is particularly useful for men, because sorry if there's any men on here, all I can see right now is Lenise. But I think it is much more difficult for men to express emotion, right? And so then I think the other thing is that knowing that they don't know how to support or understand or help you. So one of the greatest things I've found was it's something that you could put into your own little, you actually could make them into a Team Phenomenal Hope handout. I don't know if you can see my screen, but this is what I'll send to Lanice. It's from CSL Behring, who are a drug and health research company. And it's a couple of excellent handouts on ways to help a friend who has a rare disease, and then how to be an ally for someone with a rare disease. So here's what I got to thinking about. We want people to understand our rare disease, and we want them to be an ally for it, but they don't know what it is because we don't fully understand what it is. The healthcare community doesn't fully understand what it is. We're getting more and more knowledgeable, but so this is something you could hand. If someone says to you, how can I help you? You could say, well, you know, I wish you just ask me questions gently, because I've been dealing with this for a long time. I've spent a long time trying to get diagnosed, but, you know, don't ask me questions in a forceful way. Some people prefer not to talk about it. Would it help you if we talked about your health? You could say to your friends or supporters, would it help you if we talked about this? No, it wouldn't, or yes, it would. And you can find out by asking them, are they a good listener? And you don't want them to be a good talker. You want them to be a good listener. People that are very good talkers are not necessarily helpful. Friends and family are a critical part of your support network. And one person, like I said, can't be everything for you. And I think the truth is that somebody on the outside doesn't fully understand what it is to live with your disease. They just don't. They don't know what you've been through unless you've been really close and communicating the whole time. They don't know the struggles you've had. They don't know how many doctors you've been to. They don't know how many times you've been told things that weren't helpful. And sometimes people mean well, but what they say isn't helpful. It actually adds to the burden. And some of the things that are particularly unhelpful are, have you tried, let me see, have you tried, let's say, hey, have you tried magnets for this disease? I read on Google that magnets are great for this disease. And you may say, yeah, right, sure, magnets won't help. But here's the thing, there's an implication in that as a patient, isn't there? If someone asks you if you have tried something, and I'm actually going to change my screen size so I can see everybody. If a person asks you if you've tried something, am I right in saying that your response to that is that they're criticizing you and think you haven't tried everything you could to help your disease? That's often the implication. Oh, you could be doing more to help yourself. You know, have you tried this? Have you looked at this? Have you looked at that? And I think people are misguided when they say that, but they don't realize that that has a negative impact on you, okay? And so it's another thing, you know, if you have family and friends, and I apologize for my hand across the screen, but I'm trying to get everyone in there. They may mean well, they may not be trying to hurt you, trying to criticize what you're doing. But I think it's useful if you can tell them, you know, when you say that, it really makes me feel like you think I'm not trying. And I am trying everything, okay? So teaching your friends that some things they say are just not helpful is a very important part of you advocating for yourself. Just about every disease has, okay, here we go. There's my little statistic. 300 million people in the world are living with 6,000 rare diseases. So nod your head if you had a hard time learning about PAH when you first got diagnosed. Elizabeth saying no. And that's probably because you early got hooked up with somebody that knew and that could lead you in the right direction, or you had knowledge and experience. But for people who don't have medical knowledge and experience, knowing where to go to get the right information can be overwhelming. Once you tap into things like Team Phenomenal Hope and PAH.org, and you get hooked up with a PAH center or a good doctor that really understands the disease, you have much more support. But Google can be a scary place to get that information, and it's not accurate. If I Google today survival data for PAH, it's still from the late 1990s, early 2000s. And the survival data has actually improved quite a lot with the advent of new therapies and new understanding about the disease. And so you may need to say to your family and caregivers, I can't explain this to you. I need you to investigate this for me and for us so that you can understand. Put some responsibility on them. It is not your responsibility to help them understand your disease. It's your option to help them understand, but they have to be willing to do some of that work. And I think you can try and guide them to places. I don't know how many of you support groups with other people, but I will say that PAH has a ton of support groups for carers and family members. And challenge your loved ones or your friends. Say, I need you to do this for me. Will you do this for me one time? Will you go on this support group for me one time? And give them a challenge like that, but put them in charge of becoming informed about the disease.
Elizabeth, I just want to cut in real quick.
Sure.
I think that Elizabeth, I'm sorry, I'm looking at Elizabeth. Hi, Elizabeth. So I just want to cut in for 1 minute. We always invite caregivers to our support group meetings. Lots of times they will or they won't show up. Most times they don't. And I know for myself, I hesitate to invite, I'll invite friends. Some of them are on this line, but I hesitate to invite family because sometimes families just don't get it. Like I try, okay, I don't want to take a lot of time because I feel like it's a support group and everybody should be able to speak. But I feel like lots of times, it's hard to, I think that you said something that really struck me. It is not up to us to describe or to tell them about our disease. And that struck me just now. That's probably why I'm not inviting them, because my friends have researched. My family has not. And I think that is a big difference on why I don't invite. Well, okay, I've invited one, but he has not joined so far. But I think that's why we are not responsible.
No, we want them
for explaining our disease.
We want them to understand, and we need them to understand and care, but we can't make them. And I guess it's a bit like a mother and a child. Sometimes the teenage child won't listen to their mother, but they'll listen to somebody else. Who is the person that can get the information across? And I think that what happens in the world of PH in particular is that it's a progressive disease, as you all know. So you're feeling bad over time. You've probably been dealing with it for a long time. And so you've kind of had this downhill slide, if you will, and they've watched that. And unfortunately, family members, I know because I've met them and talked with them, make their own interpretations of what you're doing. And I've actually stood at hospital bedsides when family members have accused the patient of doing things deliberately to get attention. And I'm just always horrified by that kind of care. I see your hand raised. I'll come to you. I think I'm always horrified by that kind of response. And so it is very difficult because they've got a preconceived idea about what it is that is going on with you. And we have to correct that. But you are probably actually the last person that can help them understand. Kira, go ahead.
Sorry, I was a little bit late to the show.
You're fine.
I just wanted to add that, one of the other issues that I would have inviting any kind of caregivers or friends or family to this group is that this is usually the group that I talk about my issues with them. And if some of my friends and family start coming to this regularly, then the people that can relate to me with those issues, I can no longer speak to about.
You are absolutely right. 100%. This is a safe place. Which is why I actually think a separate support group for carers is a good idea. Because they have their own things they might want to talk about. Elizabeth, you had your hand up, or go ahead.
Yeah, I truly do believe that you do have your family that can be your support group. It's nice that I actually have nurses in my family, but to be honest with you, a lot of people that are family members are seeing, I'm sorry about this, I should go inside because they're doing some work outside.
It's okay.
There's a bubble that's around people, and when they see things that we're going through, our illnesses, whatever it is, they run as fast as they can to get away from it, because their bubble, their world that's around them, they don't want it to pop, to realize what we are going through. I have saw too many people, and I'm not trying to frighten anybody. I was not one of these people until recently, where your family, some family members walk because they cannot cope.
Some families
And
what?
they walk, they leave,
Yeah.
or they find ways out. Just remember one thing, that it's not our fault. And if they can't accept us, that's not our fault. That's their issue. And being your own advocate is the best thing ever. And that's why I wanted to share that, is because recently my husband did that. And it was hard, but you stick with it. Don't ever blame yourself for what other people's issues are. That's one I want to say.
Right. That is so true and so wise. And I'm sorry her husband did that. It's an awful feeling. But you look like a very strong lady.
Tough as can be.
And well, all of you are, and thank you for sharing that. It is easier to run away, and again, much as we want to be the one to help them understand, we can't be the one to help them understand as the patient always. So great points of discussion, everybody. And every family is different, right? And if we could choose our family, probably none of us would have a family. I'm just kidding. We'd have something different to what we've got.
Charlotte has a question.
Okay, go ahead, Charlotte.
Oh, no, hi, I just wanted to share something. Before coming to this group, before COVID, I was very active in a PH Association support group here in Puyallup, and I actually was the support group leader for almost 10 years. And we did 6-minute marathons every year, where we invited family to come to listen about, family and friends to come and listen about PH But the 6-minute marathon was a 6-minute walk in which the family and people who came agreed to plug their noses and wear straws, breathe through straws, while they walked for 6 minutes.
You got me, Charlotte.
Wow.
I was going to show you that later.
I know, well, I'm telling you, it's time. It's show them now. Actually,
Wow.
we cut the straws so they were about that long and put them through some blue lips that we got blue lip stickers, and we cut holes in them and put the straws through the blue lips, pasted on their lips, and then they had to hold their nose and walk for 6 minutes.
That is very impressive because the straw test, and I'll just jump to it right now. So, you know, I said earlier that words are only 7% of communication. And so sometimes showing somebody something is much better. And so the straw test, I've never heard it done for 6 minutes, but the straw test I know is you take a regular drinking straw. This one's a little bit long because it's got bendy part in it, because I have grandchildren that like the bendy part. And that is exactly what you do. You give your friend, family member a straw, put it in your mouth, pinch your nose and breathe for 1 minute. That is a very simple way to make a point. And you don't have to say any words. And I actually love the 6-minute marathon idea.
I'll tell you right now, most of them didn't make it.
No, because I think even doing this is hard. Another analogy that is very visual, because some people do need visual, they can't do it with words, is better if you get a milkshake straw, you know, like one of those fatter straws.
That's what we used.
But you can get a coffee stirrer. And when I was out traveling in the field, going to see PAH patients, I would, you know, stop by the gas station, get a drink, get gas, whatever. And they were always very generous in letting me take extra straws, and I would always take extra coffee stirrers. And that's another thing. If you can't get someone to do the straw test, and you can just ask them to do it for a minute at home, because you'll realize it's hard work, but you can say to them, my dog wants to join in, and my husband's not here, so I apologize. I will let her out. You can say, you can show them the milkshake straw or the fatter straw, and you can say, this is what your pulmonary arteries look like, and then show them the coffee straw, which we all know is tiny. And then you say, this is what mine look like.
Mm-hmm.
And again, you don't need a lot of words. So I do think that finding things like that, and I actually wonder if PHA have ever done the straw test for caregivers on the video conference, you know, on the video support groups. That'd be an interesting question to ask. I don't know how many of you were at the PAH conference, but CVS at their booth had straws in a little container that, it was a bendable plastic large straw, and it was in a little round thing with a keychain on it. If any of you want those, let Lenise know. Will you excuse me a minute while I send the dog outside? Go on.
Okay, and while she's doing that, if you want it, or if you want any of the information that Sue has given us, please email me at Lenise, Lenise, Denise with a L, Lenise at teamphenomenalhope.org. And you know what, send me your email address, and I will make sure that you get it. And I got to tell you, Charlotte, I'm going to definitely do that with somebody. That's brilliant. And Kyra, I just want to say, good heavens, you have such a great point. I can't even stand it. Oh, my gosh. Okay, I'm done. You know what, Sue, when you have, I think you're trying to see our screen and you have this big blue
No. Is that,
thing, so it's cutting out what we're reading. Yeah, see, now it's gone. Now it's gone.
okay. So, and we're talking about this. So more ways to teach and show them how to understand. Please move this. Doreen, did you raise your hand?
For this, I was going to say the same thing Lenise said, that I couldn't read a lot of your text. That's all.
Couldn't you see it now?
Yes, thank you.
So you know what, I should have two computers. Now I can see why you would have two computers, because I love watching people's facial expressions and, you know, again, words are not everything. But on one computer screen, I can't see the slide and your face. So letting your friends know that showing up for you is important. And it may be that they can go to a fundraising walk for you, even if you can't go, that if they would do something on your behalf, that could be a good thing. Or would you just come and hang out and watch a movie with me that makes me laugh, because you have no idea, you know, how much better that makes me feel. So letting them know that for you, them being present, and it may not be that you have to ask them, but just remember to thank them. If you have good friends and support people that do show up for you, remember to tell them that it really helps them, really helps you for them to show up. It means a lot to you. And so I think one of the things in helping is we want people to do something, and carers, friends struggle with not knowing what to do. It may not be that there's a physical thing that they can do for you, but there's a presence thing they can do for you. And so I think helping sort out what it is. I have a good friend, she actually used to be a PAH nurse with me with CVS, and she had to stop because she's got bad multiple sclerosis. And we live in different states, but we got pretty close while we were working together. And I just reach out periodically and let her know that that I care about her, because sorry, I'm looking at the chat. Okay. I care about her because I can't go and see her every day. I can't physically help her. I can't make her multiple sclerosis better, but I can let her know I care about her. And so remembering to say thank you for that is very important.
Who beside Elizabeth has their hand raised, please? I'm sorry, I can't see you.
Hi. Whoa, I'm sorry, that was loud. I just wanted to tell
Okay,
you guys,
Elizabeth does, somebody else does too, I can't.
one of the things I wanted to say is when we go over for a pulmonary function test, we might want to save those little clips they make us put on our noses. That would help with that test to show them how, because that's those things pinch nice and tight, and that would be a good thing to take with us for the straw thing.
Oh,
And
yeah.
then also, my son is learning support from me. And one of the things he does, because I can't do the things I used to do, he loans me he brings his Oculus over to me. And he puts it on me, and I could travel to places that I've never been, that I will never be able to do again. Like I can never scuba dive. And I've sat in the bottom of the ocean and actually enjoyed it.
Nice.
You guys ought to try it. It gives you your life back a little bit.
Nice.
What a fabulous.
Yes.
That makes me want to cry.
I want to go. There's a place in China that I want to go to. There's steps going up to the side of this Buddha, and you're supposed to go up there and you can whisper in its ear, but it's like over 1,000 steps, and I could never go. And so my son's looking for it on his Oculus so I can actually achieve that goal.
That is the coolest.
Just an idea.
That's the coolest thing.
I think that is phenomenal. I love that.
So, you know, just because we're sick doesn't mean that our world's not over with.
Exactly. Exactly.
Right.
And then, you know what, that is incredibly true. Now, I have a question. I think I have a question, which I'm pretty sure I'm wrong at. So I'm pretty sure Sue's going to say, yeah, no, maybe not. You shouldn't do that. I have a brother who makes fun of my cannula, has jokes, has this, has that. No matter how I've tried to explain, you know, he doesn't want to hear it. So I politely blocked him. I mean, personally, it felt good to me. I just hit block. I mean, he sends all kinds of texts, but I don't get them. And I, that might not be exactly the right thing to do, but it was something where I felt like, I feel better. Is that wrong?
No, I don't think it's wrong. And I remember in one of the slides earlier, I said not all support is. I think it's important to, you know, would I block him permanently? I don't know. But I think
You can have them if you want them.
right. But I think what it does, and this is what's important with a disease state of any kind or any relationship, you took control of that situation. He had control and he was making you feel bad with his actions, and your very instant action was to block him because that protected you. And so I think that is wrong. You know, we block spam people on our phones, right? If we get annoying telemarketing spam calls, we block those. And so things that are annoying and hurtful, it's okay to block them. Now, what I would say is, I would hope that you guys would have a door crack somewhere, but that maybe you take control of that crack in the door, that you say to him when you feel like it. And if you don't feel like it, you don't need to apologize. But if you feel like it, you say to him, I have blocked you because what you have said about me, to me, and about my disease is so profoundly hurtful. I don't like not having communication with you, but I need you to learn about what's going on with me and understand. And if you can't do that, then it's not helpful for me to be in your life. It's not helpful for me to have you in my life. I mean, I think you have to be very honest about that.
Okay, that makes sense. Doreen.
Yeah. Makes sense. Good.
Good sense.
Yeah.
Okay, you had a question, Doreen, because your hand was raised?
No, no, somebody else's hand is raised. I can't see who that is. Under me, Elizabeth. Elizabeth, yeah.
No, I'm done. I'll try to turn it off.
Yeah.
Yeah, I'm with Sue. You know, when you can't see everybody, you're kind of like,
I know, it's hard to do. Okay, I'm going to move on because showing up is important. So it's, you know, they want, like I said, you need to tell people what helps and hurts you. And what psychologists call this issue of saying, well, this is a great one, especially for people with cancer. Oh, everything happens for a reason. Well, what is the reason? Did I do something wrong? I mean, it's so unhelpful to say, well, everything happens for a reason, because oftentimes the implication of that is you did something wrong and you deserve this. But people don't know what to say. Like losing a child. Oh, well, you can have another baby. If you lose a pregnancy early in pregnancy, oh, well, you can get pregnant again. Yes, but that first one was a separate own little life. And so people are misguided and they say the wrong things because they don't know what to say. And I spent 17 years working in a pediatric intensive care unit at a children's hospital. And for the last 4 years I was there, my primary job was to work supporting the families whose children were dying in the ICU. And I became very passionate about communication, about words, about the fact that we talk because we want to fill the space, and that filling the space may be the most hurtful thing. And that sometimes just silence is what you need. Sort of like having the friend just come and watch a movie with me. I don't want to talk about my disease today. So this thing they call not knowing what to say and how to help is referred to as social strain. Here we go, is the magnet thing. Don't ask, have you tried this? This is a psychologist that said it implies that you haven't worked hard enough to manage your condition. Don't say, try to stay positive. And this was a learning one for me, actually. So saying you're dwelling, try not to obsess so much, be grateful for what you have. Other people have it so much worse. Look on the bright side are all most often not helpful. There may be days when it is helpful, and it may be okay for me to say, I'm grateful for what I have, but it's hard to hear someone else say that to you.
Yeah.
So it is okay to say to your friends and your family, I know you mean well. And I think that's what you have to do. You have to say, I know you mean well. And maybe you can say, I understand this is hard for you as well, because I can't explain to you exactly what's going on, but I need to tell you that these things are not helpful to me. And then tell them these other things are helpful. And then give them specific ways to help. And I'm going to share this. It's a little different when you're doing an acute thing like a surgery and cancer treatment for 6 months. But I had many people that would call and ask me, they'd say, well, let us bring you dinner one night. Just call us and let us know what you want. I don't know what I want. I suspect that a lot of you feel that way a lot of the time. And so what I learned is that the most helpful thing was people that just said, I am going to do this, and they did it. And they even said, you don't have to come to the door. I'm just going to put it on your front doorstep. I'm going to bring you lunch. I'm going to bring you dinner. I'm going to bring you whatever. I'm just going to put it on your doorstep. I'm not going to interrupt you. That was the most helpful thing to me. And so that is another thing to share with the people that you want to help care for you, is to say, I really appreciate when you say, tell me what you want, but really, then that just makes me have to think of it. And then I feel like I have to make a decision, and I can't make a decision, and I don't know what I want right now. And then I feel bad that I'm rejecting your offer of help. So that's an added burden, that someone wants to help you, but you don't know how to tell them how to help you. And then you feel guilty for not letting them help you. And so I think that's a very important dialogue for anyone that's a friend and that's engaged with you about how to help you. So give them specifics. One of our people in our neighborhood has just started coming by every morning and picking my husband up to take him walking, because he's lost so much strength and so much muscle, and he's like a PAH patient right now. He can't walk upstairs without being winded. He can't take a shower without having to lay down afterwards and recover. And so this neighbor just comes and knocks on the door and says, I'm going walking. Come on, Chuck, go with me. It's perfect. Chuck can say, no, I don't want to go, or he can choose to go for just a short way. Ask them to just listen to you sometimes, not talk. Listening is the most important skill of your caregivers. And then show them and tell them where they can learn more about what's going on with you. Ask them to be considerate. So this is if someone says, how can I help you? Just ask them to be considerate. And so I think this is a great one here. Being considerate might be, you know, I think as a helping, if you're a helper person, you want to go over, let me go over to Mary's house and help her today. Maybe I can clean, or maybe I can do her laundry, or maybe I can do that. And, you know, one way that you can be considerate is to stay away if you're sick. Don't come to my house if you're sick. And that's especially true for PH patients with COVID. And it is okay to say that. You know, I love you, I would love to see you, but please don't right now because I'm scared. This was something that came from patients with rare diseases, that you need to tell your friends and family that they have to understand that you may cancel plans at the last minute. And it is not because you don't like them. It is not because you don't want to do something. It's certainly not because you want to miss out on the fun. And, you know, people don't understand that sometimes with your physical limitations, you just can't do something, even though you may not look sick, okay? Especially if you have, like PAH, an invisible illness. So tell your family and friends, I really do want to be there, but sometimes I just can't. And I need you not to take it personally. I need you to understand that it is not a slight. It's not anything. It's just the reality of my disease. So the straw test, we already talked about that. Unwrap a straw, hold your nose closed, breathe through the straw for a minute. This is how PAH patients feel all day, every day. Simple little exercise. And then, like I said, if you can't get them to do the straw, do the largest straw in the coffee stirrer. This is just a good exercise to have in your toolbox for anytime you might have anxiety. It can be particularly useful if you're struggling to catch your breath, if you can do it. So I'm going to ask you to do it now just for practice. It's called a 5-4-3-2-1 exercise. Just sit comfortably and close your eyes. Take a couple of breaths in through your nose and out through your mouth. Now open your eyes and look around you. And I want you to see 5 things that you can see. You don't have to name them out loud in this group, but you could if you were alone. 4 things that you can feel. 3 things that you can hear. 2 things that you can smell. And 1 thing you can taste. And then take a deep breath and you're done. So that's just a very useful, calming kind of exercise. And you might even share that with your family and friends and supporters and caregivers. Talk a lot about, we haven't today, but people talk about being intentional. And I think a lot of what we're talking about here with helping our families understand, helping our friends understand, is about being intentional. It's about saying, I'm going to do things every day purposefully and not just react to the day. And I think that's really important for your caregivers as well, that, you know, you ask them to be purposeful and that you're purposeful in communicating with them. A reminder to stop and enjoy the moments that you have every day. Being intentional is the opposite of survival mode. It is taking initiative and it is thriving, and it's definitely a goal-oriented way to approach this disease. And with that, I am finished. I thank you very much. I'm gonna put my camera back on so I can see you all. And I'm gonna stop sharing and open it up for questions.
Thank you so much. You know, it's an amazing thing that I got so much out of it. You know, I don't even know what to say. I felt kind of guilty about my brother, but I'm done with that. And you know, being considerate is a good thing. And I love what Kyra said about this is the safe place. This is a safe place. And I'm going to do that 6-minute walk test. I'm sticking that straw up somebody's nose, whether they like it or not. Makes me know. I want them
Well, and
to see. And I know who I'm gonna start with. He might be unblocked in a minute. Next time I see him, then I block him back.
there you go.
But, yeah, you know, just long enough to stick the straw up his nose. That's all I gotta do. But
I love that. Mute him for a month. And then Vanessa, I'm ready to mute my adult daughter for a while. Yes, yes, yes.
Hey, Charlotte, you have a question? You muted.
I'm muted. Okay, now you can hear me.
Charlotte, you're muted. Now
Yeah, I just have an example of good friends staying away when they're not feeling well. Number one, both my daughters and my grandchildren all do that. They've always done it since I was diagnosed with this in 2005. And I just had a thing like that come up today. I'm supposed to go Wednesday to have lunch with two friends of mine. And one of them lives in an assisted living senior retirement because of her medical issues. And their facility is on lockdown because they have 19 cases of Omicron COVID, Delta 4 or 5. And I'm not getting the number 3 injection because I had such a bad reaction to number 2 booster. So I had to call them and tell them I'm not coming to that. I know you're both boosted, but I'm not coming because I can't afford the bug coming out on your clothing. I can't afford to be around it. And they understood that completely. Not a problem.
Yeah.
Right.
So I said, you know, it's me, not you. I love you both. I'd love to see you both. I just can't chance it.
Yeah.
You really
No,
can't.
that's absolutely right. And it would be wonderful if people like your daughter and your grandchildren were not coming because we know you can't get sick.
Oh, they know.
So you'd be surprised how many people are not considerate of that.
Oh, I do know. Having been a support group leader, believe me, I heard
I guess you do know
horror
that.
stories. Just absolute horror stories. So
Elizabeth, what was the name of that game that it was a game, right? That your son got?
It was an Oculus.
What is
the
that?
virtual reality headset?
It's a virtual.
Oh, okay. Well, can you spell that?
Oculus, Oculus.
It really, really has been a blessing
Okay.
for me.
I
And
gotta
the
get
kids
one of those.
love it. The kids love
okay,
it.
but I don't understand how it works. I mean, you described it, but
Well, let me give you an example. I put it on. I sat down on my recliner with my legs folded in front of me. And I actually felt like I was down in the ocean, on the floor of the ocean, sitting on a rock. Well, fish and everything was swimming around me. And everywhere I turned, there was fish. And there was, turtles and everything else swimming around me. And then the other time I sat there and I was actually watching the Northern Lights. And as I look around with this connected to my face, I can actually see the surrounding areas like I'm sitting there.
Yeah, it's a mask.
when you talked about it, then I looked it up on Google. That's like $500.
It is expensive.
Yeah,
My son owns it.
yeah.
So I can't afford it myself, but my son brought it over for me. So if you
They have
have
cheaper
kids,
ones on Amazon.
if
I'm
that's it,
sorry. They have ones on Amazon that you can hook your phone into and use your
Yeah.
phone screen as that thing, and it's like $40. And I mean, they're not as good as the Oculus, but they still do a pretty decent job. My only suggestion is those of us who are on oxygen, definitely make sure you're sitting down, because if you start
Yeah.
swinging stuff around, it'll be very easy to get tied up and trip. Not that I have any experience with that.
Oh no.
Sure.
Not, I haven't at any point tried fighting with lightsabers using one of those games and hit somebody and tied up my oxygen cord. So that
I do it
don't.
sitting. I do it sitting, and I take trips to different places. So it's a really great thing for me because I can't walk. I can't do all those things. And it makes it a lot nicer. You could go to museums, you could do lots of things.
It makes me wonder, and I have no idea. So one of my children wants an Oculus for his birthday, and I told him that my budget was $50 and an Oculus didn't fit in. And so this conversation has made me wonder is there is a way to rent VR headsets somewhere, and
I don't know.
find out about that.
It would be amazing, wouldn't it?
It would, because the idea that you, and the ones you can get on Amazon that you put your phone in, so you buy the little goggles and then your phone slides into it, and you have to put some VR programs on your phone to watch them.
YouTube actually has a VR setup where you could go into YouTube and put VR, whatever it is that you want to do, and you could hook it up into there.
So there you go. But I think I'm going to have to explore that idea, because I do think all of you know that ability to escape for a little while or feel like you've escaped for a while is so restorative.
It's amazing.
Takes you out of yourself.
I'm going to recommend that my library look into getting some of those. That is such a good idea.
It is.
To have them to rent. And libraries would be.
But talk about getting, doing things to get away from everyday everything. I know, and I know a couple of you on here, I'm a big reader. And I buy books that entertain me. I can't have I wouldn't read like Romeo and Juliet, people dying at the end, but I read books that entertain me. And now that you can get books on your
ebooks,
Kindle or your phone, for your library, you don't even have to pay for them. To me, that is, ebooks. To me, that is a really great option. What other things do some of you do to get away from it?
I actually go into Libby. That's what it's called. And it's an online. It's an online through the book. In my library, I pay $5 for a year, and I could get audiobooks and I could get all those other ones. And that's some of the stuff I do.
I have a Roku and I don't have cable anymore. All I have is a Roku, and I can watch everything I want to watch on the Roku.
I was going to say, I grew up in England and we had 3 channels on the television. And actually we didn't have television when I was growing up, except for 1 year when I was 9 and 1 year when I was 15. Otherwise, no television until I went to nursing school. And we only had 3 channels, and there were no reruns. And if you missed it when it was on, that was it. It was done. And for me, I love watching documentaries.
Yeah, me too.
That just take me to other places that are out of my world. And for me, that's a really good thing.
Yep.
you know, we all have something. And one of the things that I love to do, I was talking to Doreen about it one time, is I shop at Macy's online. Now, I have bought myself this lovely 2-carat diamond ring. I mean, gorgeous. And at the same time, I bought myself this serious sapphire bracelet. Oh, gorgeous. I bought myself this $2,000 dress. Oh, gorgeous. I put it all in my cart and then I hit delete. It just makes me feel, it makes me feel like I can do it. I got it like that. I love that part. And then I hit delete. Now, even if I didn't hit delete, Macy's would laugh and blow up, you know, just laugh themselves stupid because obviously I don't have it. But it's just my way of sitting there saying, isn't that, oh, I love that TV. Click that bracelet. Oh, click. I don't have any of this stuff. I hit delete. But just for a little while.
I go into furniture stores and I look around and I sit around in the furniture like I own it all. And then I walk out of the store.
But you know, we need something. We all
Mhm.
need
Yeah.
something.
Yeah.
And it doesn't have to be a great big thing. It doesn't have to be a
Our
super
next meeting,
expensive thing.
hopefully. Does
Go
anyone
shopping on
else?
Zillow.
It doesn't have
Go
to
on
be big.
Zillow and check out houses. That's I could never afford a house on my own, but it's nice to look at them.
Mm-hmm.
I do that too. Does anybody else use the spoon theory to explain your illness to other people? The spoon theory.
No.
Do you know what the spoon theory is? Every morning I wake up with 100 spoonfuls of energy. And everything I do decreases by so many spoonfuls, how much energy I have left for the day. And so taking a shower takes about 45 spoons. It's a lot. Cooking a meal takes about 25 spoons. So that's how my partner and my partner, who's no longer here, and I communicated about how I was feeling all the time. And I was diagnosed in 2005. So we communicated that way for 17 years. And, you know, he'd say, how many spoons have you got right now? So you can look up spoon theory online. It's a good way to explain it to people. That's another thing you can look at.
That is a very interesting thing. Frederick, what do you do to take yourself out of the world, except do you really live at the San Francisco, or are you just using that as a screen image?
I actually live in a box underneath the bridge. It has. Don't tell nobody.
For 1 second, I believed him. Honest to goodness, believed him.
Your secret is safe with me. Okay.
Thank you. Thank you. I do video games. The last one I'm working. I'm playing is Diablo Resurrection 2. I got quite a few dollars, and last night I got killed, so they wiped me out. It was pitiful to see a grown man cry, but it's okay. Other than that, I in with the public library and at Grand Army Plaza in Brooklyn, and they have the online courses, and I decided to take up Spanish.
Good for you.
Yeah, I'm very nervous. I could read pretty good, but when it comes to speaking, it's
yeah.
But I think that I've learned that the major thing when learning a language is that, as I was told, is everybody thinks they sound stupid, but you got to keep trying, and then one day everything just pops. I'm waiting for my day.
Good for you.
Good for you.
Thank you. I got my upright.
Excellent.
I got my upright rollator walker, and it's 5 feet 10 inches. It's for tall people, and been going out in the backyard and walking.
Walking with
How are
it.
you?
Yeah,
Wonderful.
that's me.
That's great. Thank you for sharing.
Thank you. Welcome.
Video games are a good way of doing it. I play Star Wars Fallen Order.
Mm.
I get to be a Jedi. I mean, what's cooler than that?
Well, we certainly all have our thing. So I put in the chat, it's been a rich and wonderful discussion. I want to thank you for your participation and sharing. I've been blessed by being part of this conversation, and I hope we've all got things to take with us and ideas to take with us. And Lenise, let's talk about maybe getting some Team Phenomenal hope handouts for families or for patients to give to their family on how to help, because I've never seen that kind of literature anywhere.
I haven't either, to be honest, and I think that, yeah, let's talk about that, because that would be really, really great. And I think that is something that is much needed. If I had it, I wouldn't have to block
Yeah.
that Twitter I blocked. But yeah, let's talk about that.
Yeah,
I think
I
that's
think
great.
I think it would be great.
First off, yeah, let's talk. Let's talk.
Let's talk.
Let's talk.
We'll do that. All right. Well, thank you everybody so much. Lenise, thank you for inviting me. It was a privilege, and I appreciate the laughs that I've had as well. It's always a good day for a laugh, right? So I hope everyone has a good day, and thank you. I'm gonna sign off, and then you guys can continue chatting if you want to, because it's your group. Okay.
Thank you.
Thank you.
Thank you
Thank
so
you.
much, Sue. Thank you.
Thank you. It was wonderful.
It was wonderful, and I thank you all. I know we've had a few technical difficulties. I'm sorry, but I hope that you all got something out of it. In our next meeting, which will be November, what we're thinking about, and please email me. Some of you do it, and this is where the ideas or the subjects for our meetings come from. Our next meeting we're thinking will be on insurances. We're all now getting every single insurance company in the world that wants us, because it's almost that time. And so we're thinking that the next meeting will be on insurance. So again, my email is Lenise, Lenise at teamphenomenalhope.org. Let me know. Also, let me know if this process was okay with you, just me sending you out my Zoom account and you just logging on. And honestly, it's my account, so the number is not going to change. If we stay with it this way, it's not going to change as long as I pay the bill, which I'm getting ready to do next month. So, and so let me know if you want to hear about the insurance. That's great. If not, we could change. Hey, Charlotte. No, I hear you. No, don't, you're unmuted. Don't mute.
Okay, I'll just type it to you.
Oh, okay. But yeah, but definitely let me know what you would like to talk about next. I hope you enjoyed this session. It was really good. I might unblock my brother in a month. Thank you, Vanessa. I'll think
Would you
about it.
mind putting your email in the
It's part
chat?
of it. That would be a good idea, wouldn't it? Thank you. Where am I? Okay.
Thank you.
No problem. Oh, no.
Yes, I've already
And you know, for
added you
November,
to my yeah. Once you've gotten an email from her, you can add her at your address to your address book.
Mhm.
You know what? I am the most challenged person on the face of the earth when it comes to technology. I try. I have last month, you know, we have, everything is recorded except for last month, because I was in charge of the recording. Now, if you want to go old school and just listen to it on voice, it would just like it's radio, you could hear that maybe, but you're sure not going to see anybody's pictures. I don't know what I did. Hoping I did it right this time. But yeah, definitely I hear from some of you and I would love to hear from all of you. And I hope that you enjoyed it. Send me ideas, send me questions if you want. But the handout, let me know. I will make sure you get it. And if there's anything Team Phenomenal Hope can do, or if you have any questions about Team Phenomenal Hope, please let me know. And I'm sorry for the technical difficulties where we had delays in speaking. I think it's on my end because Verizon's doing whatever they're doing. Whatever. But anyway, everybody be blessed, be well, be safe. Take care.
Take care. Bye.
Stop and delete. That's what I say.
Good night, everyone.
Good night.
Good night, all.
And Frederick, that
See you
box
guys.
thing. Don't do that. Because I believed it. Doreen, talk to him. Bye, everybody. Y'all be
Bye, guys.
well. Hope to see you in November. Bye.